And now I'm going to cross hatch it a little bit, so let's see if I can get a good direction. I just want you to turn toward me a bit. Oh, that's good, just like that. A little bit more toward. There you are. So we'll start up by the nose, which makes it a little bit. It's tough here. Sorry. Just a little bit sensitive there. So I'm going to stop there. Try to come in at a better spot. Sorry. Just turn to me. Just a second. Again, I think that her fold on the left was a little bit deeper than the right, and I think we're pretty even. I'm just going to put just a tad more here. And then we're going to go down to the marionette. You can see this is a little bit of a hematoma here because it's a little bit blue. So she has a little bruise on that side. You want to put some ice here and maybe a little bit on your chin. I'm just going to change syringes. Go in here. Do this a little differently. I've put in another 0.45 cc's in this nasolabial fold, and we're putting about another 0.3 cc's in the marionette line. And then I'm just going to deposit just a small amount in the mental groove. I'm going to put some ice on that before we start. I'm going on either side of this line. I'm going directly under the line. In my fanning technique, I'm trying to go on either side as well. I'll probably want to put a little bit of an intradermal filler, mid-dermal filler, to bring it up a little bit more after I deposit the radius. She's sensitive right in the center. Every place else seems to be numb. So what we have gotten is a softening. We have eliminated it completely, but I think you can see there's a softening there that she didn't have before. And as I said, I'm probably going to lift the skin just a little bit with a mid-dermal filler. This is a Hyaluronic. And this is not an unusual situation to have to use more than one product. And Laura has large pores, so you have to go a little bit deeper. So we definitely have a softening there. Nasolabial folds are very nice. We've gotten rid of this line down here, and this swelling is actually already going down. So I have used just a 1/10 of a cc of the Restylane to overlay the radius. I've put about 0.3 cc's of radius in the mental groove. We put approximately 0.45 in the nasolabial folds and about 0.3 in the mellomental folds. So once the swelling resolves, I think we're going to get just a beautiful effect and smoothing of her deeper grooves here and give her a nice youthful appearance again. Laura returns today for a reevaluation for treatment areas that she had about 2 weeks ago to her lower face. Laura was concerned about very significant deepening of her nasolabial folds. She also had concern about some very deep mellomental folds. Of course, that also made her look a little bit sad. It was pulling the sides of her mouth down. Because of the depth and severity of the folds, I felt that a heavier filler would be more appropriate for her, so I decided to use Radius, which is a subdermal filler, which is lasts a little bit longer. It lasts 1 year to 2 years, and it has a little bit of heavier content than some of the hyaluronic acid fillers. And now she just has a little bit of a hint of a fold on both sides, also the mellomental fold. By treating them, elevated the corners of her mouth and given her a much more youthful appearance. So can you smile? Okay. And relax. So you can really see, especially when she smiles, it really irons out these defects and it looks very, very attractive. Shantae has been telling me that she's concerned that she's developing some fairly deep oral rhytids. Can you purse your lips for me? And you can see that she's a little bit numb. I did give her a dental block before, so she can't really purse her lips very well. Okay, you can relax. But she is making some perioral rhytids. I gave her some Botox as well. I gave her a total of 5 units already. She's had 2 units on each side at the top, nothing in the midline, and just 1 on each side at the bottom to balance it out so she feels normal when she's eating. But she is developing some small lines in this area, and we're going to try to do the same thing we did with the upper face and try to inject these lines with just a tiny amount. I'm just going to have to move her face around so I really have a good view and the light is not obstructing my view. I'm hoping that the dental block is enough. The lips are very sensitive. There are 2 ways to give this, and I'm going to start with the linear application. Sometimes that leaves a little bit of a bump there after you put it in, but that goes down pretty quickly, and it almost looks like I haven't done anything except that the line to me looks a little bit less prominent. So it's